Welcome to GutTalk TV by Deb, YouTube channel focused on closing the communication and knowledge gap in gut health. Please press the subscribe button below.
Hello everyone, I'm Dr. Jakob.
Hello, I'm Dr. Yoon. We are gastroenterologists from Australia.
We've been getting a lot of questions lately from our patients about different medications and their effect on COVID-19 infection.
And we are here to address some of your questions. So Dr. Bigan, we've been hearing lots and lots of tabloids regarding hydroxychloroquine, especially in USA. Trump was saying that it's a miracle cure. What's your thoughts on and evidence behind using hydroxychloroquine during COVID-19?
So hydroxychloroquine, which is also known by its trade name of Plaquenil, has been getting a lot of press lately, but I don't think it's a miracle cure. The initial reports of this agent came from countries that are having a lot of cases, including China, Italy, and France, that showed that patients who are taking this medication seem to have lower rates of infections and less severe infections. So that prompted a lot of thought about this agent may have some benefit in COVID-19. However, the trials that have been performed so far have been small trials that have not been blinded and are rarely randomized, and they haven't shown a large effect of this medication, if any at all. There are some very large trials ongoing right now to investigate further, and once we get the results of those, we'll be able to make more definitive claims, but at this time I think there's insufficient evidence to really promote this medication.
So it seems like there's not a huge evidence that's helpful, but it doesn't mean that there is no benefit. Then should we all take hydroxychloroquine when we got COVID-19, and is there any potential side effect associated with it?
Yeah, well, hydroxychloroquine is an old medication. It's been around for a number of decades, and there are some very well described side effects that come along with this medication. One that sounds pretty risky indeed is that it can cause cardiac arrhythmias or irregular heart rhythms, and so that's something to be aware of. In addition, patients who are on Plaquenil for things like lupus or other conditions where it's approved have to have their eyes monitored on a regular basis because it can cause eye problems as well.
So hydroxychloroquine is not only hard to pronunciate, but probably you shouldn't take it unless it's really necessary.
Yes, and always through a doctor who can monitor for these side effects and symptoms. All right, Yoon, another medication that's been in the news a lot about COVID-19 has been NSAIDs, ibuprofen and the like, and how this might actually worsen COVID-19 infections.
So NSAIDs, so some of the brand name that you might be familiar with will be ibuprofen, Brufen, or naproxen. So yes, there's some reports out there that shows that taking regular NSAIDs can worsen the outcome on patients who are already got COVID-19. And the really theory behind it, even there's not a lot of study behind it, show that it alters the gut lining, and it might then result in viral spread, as about 10 to 20% of patients with the COVID-19 got GI symptoms. Not only that, but also taking NSAID decrease the production of prostaglandin. So what that means is your body's ability to fight infection decreases. So I guess with those two theory behind it, probably it's not a good outcome, and that's why people can observe that there's a worse outcome in those patients who takes it.
So a lot of patients are taking these type of medications for aches and pains or their arthritis. Do patients need to stop their NSAIDs if they're taking them for those indications?
So my answer will be, if you can take paracetamol, that might be the safer option. However, if you have a more benefit taking NSAIDs, then you should do so. But keep aware that there's side effect associated with it, not only for the COVID-19 issue, but some common thing that you can have ulcers in your stomach and so on. So do be reasonable with what you're taking, and also talk to your doctor who is prescribing NSAIDs to you, and make sure that you are taking absolutely minimum amount that you can take.
And if people do develop symptoms of a viral infection, fever, cough, shortness of breath,
then in that case, if you think you might have a COVID-19 symptom, it might be best to stop the NSAIDs intake. And next question, Dr. Vigan, will be a question around antibiotics. People believe that taking antibiotics can be helpful during COVID-19. What's your thoughts on that?
Yes, well, it makes sense that COVID-19 is an infection, and when people get infections, we often find that patients are prescribed antibiotics. but it's important to remember that antibiotics are against bacteria, and they don't have any role to play in viruses like COVID-19. So we wouldn't recommend antibiotics for routine use in COVID-19 infections. Sometimes patients admitted to hospital do require antibiotics when they get a superinfection with a bacteria.
Mm-hmm. So don't use antibiotics to kill the virus.
No,
very
won't
reasonable.
work.
Yes. However, then people might think, how about antiviral therapy?
Mm-hmm. Now this makes a lot more sense because now we're talking about something that actually has activity against viruses. But there are all different kinds of viruses out there, even respiratory viruses. So medications directed against influenza, the common virus that causes flu, are ineffective against COVID-19. So things like Tamiflu do not work. However, newer antivirals, those directed against viruses like Ebola or even some HIV medications may have some efficacy in COVID-19 and are being trialed as we speak. However, we still need larger trials before we can say definitively whether or not they'll help in those patients.
Mm-hmm.
All right, another pharmaceutical, if you will, is melatonin. Melatonin is often sold as a sleep aid. It's often touted as the natural sleep remedy. But interestingly, there's been some reports about melatonin and COVID-19. Is there any evidence that melatonin might improve COVID-19?
I don't think there's any solid evidence that show that taking melatonin improves the symptoms of COVID-19 or be helpful in any way. However, there's some observation that was seen that showed that people who are taking melatonin had a lower inflammation marker in the blood test, which is TNF alpha level, and those who are really sick, has a cytokine storm, for example, had a higher level of it, and those people were not on melatonin. I think it's more of the observation and association that was seen rather than direct impact on melatonin. Really, if you think about it, melatonin helps you to have a better sleep. And if you have impaired sleep, then it reduces the immune system. If you sleep better, obviously it's immune boosting. So I guess it's a good sleep. That's the key to immune boosting property rather than actual medication itself.
And how much should people be sleeping in order to have good immune systems?
That's a good question. So some people then think about taking messages saying, oh, I will sleep more and more and it will boost my immune system. However, multiple studies that actually show that 7 to 8 hours of sleep is the ideal time, and that's good for your immune system, and not only that, but mental health as well. So more you sleep, there's a study showing that you have increased amount of depression rate with the more sleep. So you want to have a just amount of sleep.
And any problems with taking melatonin? If people take too much melatonin, are there any side effects they should watch out for?
Yes, so too much melatonin can have a headache, agitation, nightmares, or GI symptoms, and some people can be drowsy throughout the day if you're really sensitive to those medication. So you want to take low dose if possible.
Okay, so it sounds like melatonin can be a useful sleep aid to ensure that we get the proper amount of sleep, but just like Goldilocks, you need just the right amount, not too much and not too little.
That's right. And like all the advice, we will say rather than just focus on medication, it's really good to do simple things: sleep well, eat well, and exercise a moderate amount, which sounds very simple, but that's what's going to be immune boosting rather than taking extra stuff. So I hope you find this guidance useful. If you have any questions or concern, please leave a comment below and we'll try to address it.
Most importantly, please stay safe. For more GutTalk TV updates, please press the subscribe button below and stay informed.